Hi everyone, I am Dr. Gaurang Deshpande, consultant rheumatologist working in Bangalore. So today we will be talking about low back pain. Many young adults they come to us with chronic low back pain. So is it just posture related or it is some deeper problem like ankylosing spondylitis? So let's see the difference between the two. What is ankylosing spondylitis? So ankylosing spondylitis is a chronic inflammatory condition of the spine which affects the vertebral bones of the spine and sacroiliac joint. Sacroiliac joint is a part of the body which joins the spine with the pelvic bone. So usually this condition happens in men between 20 to 40 years of age, and it is characterized by long-standing chronic pain in the lower back and buttock region, which is usually more in the morning. So how does this pain from the abnormal posture or because of excessive use of gym differs from the pain in ankylosing spondylitis? So pain in ankylosing spondylitis has typical features. It is usually more in the morning hours and associated with the stiffness of around 30 minutes. The stiffness means you won't be able to get up from the bed or you won't be able to do the day-to-day activity early in the morning hours. And after some point of time, it will become little better to do the activities and you will feel little better. The stiffness will reduce. Apart from that, this pain isn't triggered by doing some heavy activity like lifting something or that, but it is more after the resting period. And it gets slowly with it improves with the movement. Apart from that, there are some other features also which can be associated with this low back pain. You can have joint pains like in the knee or ankle or hands. You can have pain in the rib cage like chest bones. You can have eye inflammation with the redness. You can have gut issues as well. So now we'll see how to diagnose this ankylosing spondylitis. So ankylosing spondylitis is diagnosed mainly based with this clinical history and examination findings. Apart from that, we do some blood tests like ESR and CRP to see the level of inflammation. We do the blood test called HLA-B27, which is a genetic test which leads to confirmation of the diagnosis. And apart from that, imaging like MRI and X-ray, they also aid in the diagnosis. So now let's come to the treatment of ankylosing spondylitis. So here we will see how to treat this condition. So the treatment is divided into two parts. One is non-pharmacological treatment and one is pharmacological treatment. So pharmacological treatment, as the name goes, it is associated with the medications. And the non-pharmacological treatment is also important, which includes diet modification to have healthy diet, have good lifestyle with adequate sleep cycle, to avoid smoking, then do regular exercise in the morning, and you can also do physiotherapy, which is advised by physiotherapist, and you can follow that advice. In pharmacological treatment, we have again 2 to 3 divisions. One is anti-inflammatory drugs called NSAIDs, which immediately relieves the pain and which is the initial first treatment of choice. Then there are second and third line treatments which are associated, which involves treating the patients with the group of drug called DMARDs, which are disease modifying anti-rheumatic agents, which are basically immunosuppressants, and they reduce the inflammation in the joints. Depending on the severity of the disease, we choose which immunosuppression has to be given. So this is how it completes the therapy of ankylosing spondylitis, and the patient has to be on regular follow-up with the doctors, and the doctors also has to check regularly the level of inflammation and whether there is inflammation in other sites as well, like eyes, skin and gut, and they have to treat that. So if you are suffering from any of the symptoms which I have mentioned of chronic low back pain with features of inflammation, then you should consider visiting a rheumatologist nearby you. And you should also keep yourself healthy